get my mask here. She's talking about COVID. If I get COVID.
Okay, guys, my name is Zora, and my topic is COVID-19. Okay, so COVID-19 is a highly contagious respiratory disease that's spread through droplets in the air. By someone coughing, speaking, sneezing. I know we all noticed in 2020 you had to keep your distance because of the droplets. That's the reason. It is caused by SARS-CoV-2 virus, which belongs to the coronavirus family. There are 26 variants of COVID, and they present from a common cold to very severe. Symptoms, there's a bunch of symptoms. I'm just going to give you a couple. Fever, chills, cough, shortness of breath. One that was commonly known in 2020 was like loss of taste. Fatigue, body aches. That's kind of common with common colds as well, but that's something that's specific to COVID as well. And then some prevention methods. You can get vaccinated and stay up to date with your boosters. Wash and sanitize your hands frequently and cover your mouth and nose when sneezing and coughing. Here's some examples of like the symptoms. I also didn't include it here, but on my paper I have the diagnosis. A common diagnosis that we didn't know of, or we do know of more commonly, is the reverse transcription polymerase chain reaction test, which is the PCR. If you think about going to Walgreens, CVS, or any health clinics where they just swab your nose, that's that test. And there's also the antigen test, which is another commonly used test. Complications. You can get acute respiratory distress syndrome, shock caused by infection, heart problems, and it can go as far as death. As we saw, the numbers in 2020 were sadly high of deaths because of COVID. It affects your respiratory system, and that's what you need to breathe and live and everything like that. So death was a common thing. Treatment. So treatment includes resting and staying hydrated, taking over-the-counter medicines like ibuprofen, and it just kind of simplifies your symptoms and gives you a little bit of relief. And also monitoring your symptoms closely to seek medical help if they get worse.
So go back to treatment. So I'm a 52-year-old guy. I don't have much comorbidity. I get COVID. I don't want to get the headache of having it for a long time. I'm not young like you guys with a more active immune system. I don't have any comorbidity, but I just want this thing to go away. What's my option treatment-wise to get that virus?
Vaccines.
I already got my vaccine.
Okay, and kind of like over-the-counter medicines, that's just going to be the most effective for someone that's not moving around too much. That gives you the opportunity to take medication to help relieve them.
But I do the antibiotic. Anybody can help me out here? You guys are future healthcare workers. Prescribe me something. What's the antiviral I need to take?
I don't know. What the?
They take viral for COVID.
It's a virus.
That's all right.
The vaccine.
Viral.
Oh, she go search it, huh? Go search it, you'll find it. Go search it, you'll find it. Go search it. Go search it. Start with P. And it's on TV all the time.
Penicillin?
Huh?
No.
Because of this, but
I think my take was.
it's on TV all the time.
Promethazine?
I think I know. Paxlovid.
Yes.
Yeah, that's what it is. But how do you say the first name, Mr. Tom?
Paxlovid.
No, the N nine
Oxycodone.
you don't. Okay.
That's supposed to be part. That's what part of that list. Because we're talking about the ibuprofen is a comfort treatment for the what? Pain. But that Paxlovid, that's what's supposed to be up there. So next time when you guys doing that, that's you can put on there. Okay, let's go.
So our target demographics, basically who's affected most. COVID-19 affects all age groups. The older adults are higher risks for severe illness and possibly death. The graph shows that while infections occur in all ages, fatalities are more common in older individuals. So just kind of, you can see the progression here.
And those are the people who we gave who to? Those are the people who, when they get COVID, we're going to give them what? Paxlovid. If there is no contraindication.
Okay, and frequency of COVID-19. COVID-19 continues to circulate, but its overall frequency is moderate and gradually decreasing nationwide. At a point, all these numbers were tripled. You can definitely tell the difference between now and beforehand in 2020. But this is just like showing you, surprisingly, Florida is really at its all-time high for COVID. Lastly, disease progression. Day 1, you'll have mild symptoms, and they'll begin like low-grade fever and fatigue. And then day 2, fatigue worsens and throat irritation starts. Day 3, respiratory symptoms appear, dry cough, mild breathing issues, and then after that, it's really not too much documented because people usually go to the doctor because it gets worse and people have to get on ventilators and things like that. And then here's my
Did you? You may have covered. Go back. Let me see the transmission. Yeah.
It's within my first one. Your transmission through coughs, sneezes, and talking.
Okay. How would this affect your future role as a future nurse? This pandemic, this COVID-19.
COVID-19 made me see things like very different. Made me see a lot of things differently, and especially like wanting to go into the healthcare field. I am more cautious about being protected and PPE, masks, and things like that, because I know firsthand of like having loved ones get this disease and things like that. So I would be more equipped to protect myself in that.
Okay. Thank you very much.